Hi everyone, I'm Dr Sanil Rege, consultant psychiatrist. Welcome to the Psychopharmacology Masterclass series. A big thank you to all of you for your participation. We've received some great feedback that inspires us to do more, and we're incredibly thankful for your contributions. As you embark on this journey through the Psychopharmacology Masterclass series, you'll immediately recognize the fast pace and the wealth of information that spans over 7.5 hours. The fast pace and the vast amount of information is a deliberate choice to ignite a specific state of alertness and arousal that optimizes learning, even if it initially feels a bit daunting. The masterclass is designed to highlight the complexities of psychopharmacology, reflecting the situations that we encounter in real-life clinical practice. Our approach to learning is based on the principle of differential learning, where we intentionally challenge you with a rapid pace and complex real-world content. What is differential learning? This approach considers learning as a self-organizing process that is initiated by destabilizing the system through conveying diffuse energy in the form of amplifying the system's fluctuations stochastically. What does this mean in simple terms? In simple terms, this means that variability boosts exploration and learning by shaking up the system and amplifying fluctuations randomly. Instead of learning by repetition, we encourage you to adapt to continuous challenges. This adaptation enhances a vital skill in psychopharmacology, pattern recognition. We know that in the real world, critical clinical decisions are often made under pressure. By immersing you in an environment that simulates a certain amount of cognitive overload, we aim to enhance your problem-solving abilities, your pattern recognition skills, preparing you to navigate the intricate world of psychopharmacology in your real-world practice. This approach ultimately helps bridge the gap between the classroom and the real-world scenarios. Now, although in this psychopharmacology series we focus on psychopharmacology, it's important to recognize that in clinical practice, we should always implement a diagnostic hierarchy, a diagnostic formulation. The diagnostic hierarchy provides you with a way to navigate complex scenarios. The diagnostic hierarchy helps you rule out conditions. You start off from organic elements. You then move towards medication and substance-related aspects, such as alcohol, cannabis, other illicit substances. But on the other hand, we've also got to think about the impact of medication, for example, side effects. Next level down, we think about the mesolimbic activation system. This is where the salience network comes in. Lower down, we think about the depressive syndrome, here predominantly in focus of the frontostriatal circuits. We ask the question, are we looking at a broad spectrum depressive syndrome involving activity, cognition, and emotional domains, versus the milder end of the spectrum where predominant emotional aspects are involved? Lower down, on the same level, we have anxiety disorders, we have trauma-related disorders, but we also think about current stresses. We then think about obsessive compulsive disorder and eating disorders. And finally, lower down, we think about personality factors. Through this, right up at the top, we think about important elements such as neurodevelopmental aspects because they pervade through this entire diagnostic hierarchy. We think about sleep as well. As you can see, this is just a little snippet that gives you an idea about the thinking that's required when we move towards a diagnostic formulation. Now that I've provided you with the insight into the course's underlying concept, let me outline the path ahead. This is what to expect on the journey. In this series, we adopt a unique approach where we navigate 4 key domains. First, symptoms and phenomenology. Next, neurobiology. Then, pharmacology, and finally, the medication choice. We forge connections between these domains, linking symptoms to their underlying neurobiology, connecting neurobiology to the realm of psychopharmacology, and from there, deriving appropriate treatment choices. Initially, this approach may appear random and disjointed, but it mirrors the complexity of real-world clinical practice. We move between these domains sometimes seemingly spontaneously, randomly fluctuating between these domains, much like the unpredictable nature of patient presentations. For example, a patient may present with anxiety, but a deeper exploration of phenomenology reveals psychomotor agitation or arousal or ruminations or nightmares. At other times, medication-related effects may take the spotlight, prompting us to backtrack from the medication to the psychopharmacology, then to the neurobiology, and then to the patient symptoms. Thus, through the series, we will fluidly transition between these 4 domains. Now, the good news. The principle of differential learning tells us that gradually this seemingly chaotic process evolves into organized learning, ultimately preparing you for the complexities in real-world practice. And this journey of self-organization can begin through the structured approach to learning awaiting you in our Academy by Psych scene. Within our academy, you'll find specialized courses that focus on specific disorders, providing you an avenue to expand your comprehension of the specific psychiatric disorders. For those looking to expand your horizons even further, besides the structured interactive courses, we also have a number of webinars to tap into the collective wisdom of experts. We have audiovisual lectures, further enriching your learning journey. Armed with these insights, I invite you to embark on a stimulating and interactive masterclass taking you into the fascinating world of psychopharmacology. We look forward to bringing you more exciting content in the future. Until then, thank you so much for being part of this journey. I look forward to seeing you on the other side in the Academy.